In today's modern society, we've become used to this idea that there's a pill for every ill. So if you can't sleep, pop a sleeping tablet, right? Wrong. And I'm going to tell you why I think it's wrong. So let's begin with, there are two major groups of sleeping tablets. There are the benzodiazepines, medications like diazepam, temazepam, trade names that might be known, Valium, Normason, Moladon. And then there are the Z drugs, Zopiclone, Zolpidem, medications like that, and their trade names might be known to you as Ambien, Stilnox and others. And there are lots of problems with these medications. First, I always mention, is that they do affect your memory, because dreaming sleep helps consolidate good memory, and these pills affect that. And we know that memory is less good when you take a sleeping pill. That might be really important if you're a student, say. But crucially, I also warn people that there's a greater risk of motor vehicle accident and falls, particularly in the elderly, the day after you've taken a sleeping pill. And that could be a very, very important point for someone who drives a lot, for instance. But then, even more important than that, in my view, is that when you take the sleeping pill, it works, but it doesn't reset your sleep. All it does is make you sleep well on one night, but then the next night your sleep will be as bad or worse than it was before. And then you say, okay, well, maybe I'll just take one every night. What's wrong with that? Two things. One, the receptors get used to the medications very quickly, and then you might need to escalate the dose, which is no good for anyone. And even more importantly, when those receptors get used to them, then it's very hard to come off. These pills are very addictive. So there are lots of problems with these pills. And there are other versions that people take as well. Things like antihistamines and also some antipsychotics. And we call this sort of dirty use of a drug, because what we're doing is taking a medication for its side effect, sedation, but not its actual effect as an antihistamine or antipsychotic. And they have all the same problems that I've mentioned before. So, what's the solution if you're not sleeping well? If it's not to take a pill? Well, to find out that, we'll have to listen to the next episodes.